Thank you for inviting me to participate in the third festival of social solidarity with rare people, the rare heat. In this brief presentation, I report two issues. First, most critical aspects of rare medicine and their significance in the presence of pandemic conditions. Second, the importance of international collaborations to solve rare disease problems. I will address them in reference to India. COVID-19 pandemic is an unwelcome reminder for all of us. You all agree that the health matters for all individuals, societies, and to global economy. Policymakers that include international, national, and local decision makers wishing to contribute to healthy recovery can now take decisive steps by shaping the way we live, work, and consume. In India, rare diseases do not have an acceptable definition. However, it is estimated that there are 80 to 90 million patients with 7,000 rare diseases. Globally, only 5% of them have treatments, but no cures. But the way India is not an exception. We, the Indian Organization for Rare Diseases, working with the Government of India and patient groups, is raising the awareness, advocating public policy, promoting diagnosis and treatments for rare diseases. Our recent sample survey indicated that 24% of Indian people have never heard the phrase rare diseases until recently. Therefore, there is a lot of work to be done in India. The government is trying to do what it can within the resources it has. In this context, let me point out to you that Russia spends $893 US per capita, while India spends only $75 US for healthcare. Therefore, it is essential to learn India's healthcare system before we talk about rare diseases and orphan drugs. It is very complex and is two-tier system, private and public. The central government makes the policies and regulations while state government delivers the healthcare. In India, private healthcare costs about 4 times more than the public sector. Only a tiny percentage of people have state-sponsored health insurance. One should notice that India is the world's largest provider of generic drugs. Presently, for example, over 80% of antiviral drugs used globally are supplied by Indian pharmaceutical firms. By 2025, the Indian pharmaceutical sector is expected to grow to US 100 billions. Medical devices market to grow US 25 billions. Bulk drug intermediates and formulations export to India stood in 2020 at 20 billions. The government of India unveiled a program called Pharma Vision 2020 to make India a global leader in end-to-end manufacturing. Globally, orphan drugs are expensive and the market for them is tiny due to small rare disease population. To encourage pharma companies to produce orphan drugs, in 1983, the US Orphan Drug Act was created and its modified versions were adopted by many countries, but not in India at this time. Orphan drugs are not readily available, and those available are very expensive and unaffordable for rare diseases patients. There are fewer or no competitors, and there is a high level of unmet need for orphan drugs. At present, India's healthcare budget stands at 1.15% of GDP for 1.3 billion people. Therefore, allocating resources to treat a person with a rare and expensive disorder over a person with a more frequent, less expensive disorder is a problem for policymakers. Understandably, politicians are concerned, but rare disease patients, like any other patients, deserve equal justice not only in India but globally. A year ago, the Ministry of Health and Family Welfare drafted national policy for the treatment of rare diseases. It brought up a significant issue, among others, namely affordability and availability of orphan drugs. The most reported or common rare diseases are hemophilia, thalassemia, sickle cell anemia, primary immunodeficiency in children, autoimmune diseases, lysosomal storage disorders, cystic fibrosis, muscular dystrophy, and few others. Among many reasons, the above list of rare diseases has gotten attention over other rare diseases because of the patient voice. Enzyme replacement therapy for lysosomal storage disorder is marketed by multinational companies, starting with compassionate use, and only a handful of patients were able to obtain the medicine. How can medicines be made available to all rare disease patients? There is no simple solution for this global problem. In order price to come down, the number of consumers for orphan drugs, that is patients, should increase. Since no one country has a large pool of patients, it is only possible if one considers including all global rare disease population for the treatment. It is doubtful that the developing countries can afford prices that are affordable in developed countries. Therefore, procurement of medicines by governments, domestic manufacture to produce orphan drugs, which are no longer under patent or orphan drug exclusivity protection, or with a license agreement with the multinational companies, should be encouraged. Many developed and developing countries have a list of essential medicines for common diseases for the benefit of public health. Similarly, it is necessary to have a list of essential drugs for rare diseases. The rare essential list should contain most efficacious, safe, and cost-effective medicines for priority conditions. Priority conditions are determined by disease severity and its population, and are selected based on current and future health relevance. Such a list will assist the procurement, reimbursement schemes, etc., which drastically contribute to the affordability of orphan drugs. I realize the expert committee appointed by the policymakers to select the list of essential medicines for rare disease may have concerns because of the smaller number of patients, clinical benefits, etc. However, we argue that the rare diseases population may be small, but their burden far exceeds the combined burden of infectious disease such as TB and malaria. Further, rare diseases are lifelong diseases. That death is the end point for many. Rare diseases are not localized, and they neither distinguish national boundaries nor social and economic equity. Everyone is vulnerable. In this regard, international collaboration is a must to have. Such efforts have already started. Rare Disease International, a global alliance, evolved from European Organization for Rare Disorders and is now an independent body. It advocates rare diseases as an international public health priority. Rare Disease International has more than 60 member organizations for over 40 countries that in turn represents rare disease patient group in more than 100 countries worldwide. Rare Disease International addresses public health needs and issues related rare diseases. It ensures the achievement of universal health care that is inclusive of rare diseases. With the collaboration of WHO, Rare Disease International initiated a collaborative global network for rare diseases to group rare diseases by therapeutic areas that encompass all rare diseases. Therefore, no one is left behind. This is just the tip of the iceberg. There is so much work to be accomplished by global collaborations. Thank you.